Mental Health in Young Adults of the U.S. Military by Flora Flores, Deneen Perkins, David Firth, Robert Underwood, Alicia Harper, and Andrea Brooks. Community and Public Health. Dr. Nina Bell, March 23, 2015. Thesis statement. Mental illness among our nation's military is an increasing concern, which needs immediate attention and more prevention and treatment programs. Assessment. The target population is mental health of young adults in the U.S. military. We are not including gender or race. There is a concern for mental health among military members and an increasing number of suicides each year. 1 out of 5 veterans of the Iraq and Afghanistan wars is diagnosed with PTSD, and it's estimated that 30% of Vietnam veterans has PTSD. The suicide rates of veterans are nearly twice that of the general population, and 8,000 veterans die by suicide each year. The essential services that assess these issues are monitoring mental health behaviors like suicidal behavior. The Center for Deployment Psychology provides consultation services to veterans. The Defense Department conducts studies. A team of behavioral health professionals perform mental health screening to diagnose symptoms and investigate the cause. About 70 to 90% of individuals with mental illness achieve an improved quality of life with mental health treatment. As you can see here, PTSD is highest among privates in the military. From 2007 to 2010, the number of cases of all mental disorders has risen among all veterans. Traumatic events leading to PTSD are more likely to occur if the veteran was hurt or close to a veteran that was hurt or killed. The intensity of the trauma and lack of support after will also increase the chances of developing PTSD. If the military member felt like they were not in control during the traumatic event, that also increases the likelihood of developing a mental disorder. U.S. Navy Hospital Corpsman 3rd Class Sean Stevenson takes a knee while on a security patrol in Sangin, Afghanistan, June 6, 2011. Mental health among young adults in our military is of concern. The statistics show that more military members have died from suicide than combat. About 8,000 veterans were known to die from suicide each year. 1 in 5 veterans of Afghanistan and Iraq wars have been diagnosed with PTSD, which is estimated to be about 300,000 total now. Also, about 30% of the military members from the Vietnam War have PTSD. PTSD is a psychiatric disorder that can occur in people who have experienced or witnessed life-threatening events. Intrusion, avoidance, and hyperarousal are the 3 categories of PTSD symptoms. Intrusion is when a veteran has memories, flashbacks, or nightmares of the war. Avoidance is when a veteran avoids close emotional relationships with friends and family and the inability to resolve painful feelings. Hyperarousal is when they act as if they are constantly threatened, suddenly irritable or explosive, or a constant feeling of danger. Treatment for veterans offers many different forms of therapy, including cognitive behavioral therapy, exposure therapy, psychodynamic therapy, family therapy, discussion groups, and peer counseling, and medication. The United States government has spent a lot of money to study and research PTSD and TBI in our military personnel. They have opened up many treatment facilities around the world and at the major military medical facilities. The Department of Defense and the United States Military Healthcare System have started up the Defense and Veterans Brain Injury Center in 1992, which is the hub of all research and investigative studies done through Defensive Centers of Excellence. National Intrepid Center of Excellence, Center for Deployment Psychology, Center for the Study of Traumatic Stress, and Veterans Affairs. There are many other partners within the DoD, DVBIC, and the military health system. In fiscal year 2011, 476,515 veterans with primary or secondary diagnosis of PTSD received treatment at Departments of Veterans Affairs, medical centers, and clinics. In 2010, Secretary Shinseki reduces the evidence needed by veterans seeking health care and disability compensation for post-traumatic stress disorder. The simplified process allows for faster and more accurate decisions and faster access to medical care to veterans. All veterans come to VA for the first time are screened for the presence of symptoms of PTSD and depression, and then treatment is driven by a recovery orientation, which includes a focus on the veteran's needs and preferences in order to help them fulfill their personal goals and live meaningful lives. VA has launched Make a Connection, Strong at Broken Places, and About Face campaigns that aim to help veterans feel comfortable talking about PTSD and seeking help if need be. Make the Connection is a public awareness campaign by VA that provides personal testimonies and resources to help veterans discover ways to improve their lives. Many of our nation's veterans, from those who served in World War II to those involved in current conflicts, return not only with physical wounds but also mental health issues that you may not recognize. About Face is a subsidiary of VA's National Center for PTSD. It is dedicated to changing the lives of veterans with post-traumatic stress disorder. Here, vets can learn about PTSD, explore treatment options, and most importantly, hear stories from other vets who have faced PTSD and regained control of their lives. Strong at Broken Places aims to break the persuasive stereotypes about the downtrodden veteran that have persisted since the Civil War. When we're in uniform, we're considered heroes, often thanked for our service. But once we take off the uniform, the world sometimes views us differently. Given this environment, veterans can be resistant to speaking openly about their military experiences in the classroom, at work, or with family and friends, thus hampering the reintegration process. At VA, we aim to break that cycle. One way we're trying to do that is with the launch of Strong at the Broken Places. The idea is to convey to civilians and veterans that success and healing after leaving the military is possible. The military providers and personnel have gone through a lot of training to learn about post-traumatic stress disorder and traumatic brain injury. Learning what the causes are and ways to treat or assist in treatment of PTSD and TBI. There is ongoing research and studies to help educate and the providers and individuals cope with and treat PTSD and TBI. There are many policies in place to help prevent PTSD and TBI. Prevention of PTSD can provincially reduce an individual's suffering. There are two different types of strategies used. Universal prevention is to deliver interventions to all people exposed to a trauma, regardless of the symptoms or risk of developing PTSD. Targeted prevention is based on the fact that although many people experience some symptoms of PTSD after trauma, only a relatively small percentage develop the psychiatric disorder of PTSD and its associated disability. The goal of targeting prevention is to identify among all the people exposed to a trauma those who are at high risk of developing the disorder of PTSD, and then intervene only with those at high risk. The President of the United States signed a bill, Clay Hunt Suicide Prevention for American Veterans Act, on February 3, 2015, that requires the Secretary of Veterans Affairs to 1. Arrange for an independent third-party evaluation to be conducted by September 30, 2018, and each fiscal year thereafter, of the veterans' mental health care, suicide prevention programs. And 2. Submit a report to Congress by December 1st, 2018, and each year thereafter, containing the most recent evaluations not yet submitted to the Congress and any recommendations the Secretary considers appropriate. The prevention of PTSD can involve various psychological and pharmacological approaches. These interventions have been used both separately and in combination, though PTSD and TBI can be different to prevent, and some class or severity of TBI is inevitable when going on deployments. The only true way to prevent PTSD, TB, and TBI is to live in a bubble or in a padded room. And even then, that could cause PTSD. There are educational materials for providers and individuals. There are training exercises prior to deployments for both the individual and the providers. There are pre-deployment checklists, online training and seminars. There are continued advances in technology protecting the individual's head to help prevent or to reduce the severity of impact to the brain that causes TBI. There are many ways to prevent PTSD and TBI. According to the Center of Disease Control and Prevention, approximately 1.7 million people sustain a TBI each year. In the military since 2000, more than 265,000 service members have sustained a form of TBI. Prevention in a deployed setting would include, but not limited to, wearing a helmet at all times, wearing safety belts when traveling in motor vehicles, inspecting weapons systems, and maintaining work areas. Prevention at a home setting would include, but not limited to, seatbelts, not drinking and driving, and being aware of surroundings. There are many ways to help prevent, but education and situational awareness are the biggest factors. Assurance. Veterans need to be assured that they are in good hands. Keeping in order and following through all the guidelines is necessary. A patient is in need of help and needs to feel safe and to be assured that they will get better. Developing a group will improve a veteran's health quicker. Evaluating is in place to continue improvement on our veterans. The leadership in veterans workforce assures competence, assuring military is safe. Veterans need to have provider care and follow up with his or her primary doctor. The enforcement of laws is necessary so they may be covered under health insurance. Developing and creating policies will improve the way veterans cope with their struggle. The public health representative should keep a close eye on his or her patient. Having a close relationship to where they feel comfortable is necessary. Monitoring their health also ensures one from a breakdown, keeping in mind that the veterans need the full attention because they're going to be under stressful situations. Military members can get addicted to overusing prescription drugs. Also, it may affect the behavior of the soldier. Aggression has the highest number of cases of side effects of psychiatric drugs, with 8,219 cases. This is why a public health should diagnose and investigate. Give an Hour. This is a nonprofit organization that provides free mental health services to U.S. military personnel and their families. Conclusion. Mental illness among our military members and veterans has been an increasing concern. This health issue needs more attention, prevention plans, and treatment services. Suicidal rates among military veterans are double that of civilians. PTSD rates in military members are increasing each year. There are many treatment plans in place which are helping, but we need to raise awareness. Cognitive behavioral therapy, counseling, and medication are a few forms of treatment. Prevention plans are the key to this issue and are being implemented now. Prevention plans are aimed at identifying and diagnosing veterans after deployment and assessing if they are at risk for developing PTSD or suicide. If they are, there are psychological and pharmacological treatments available. Make the Connection, About Face, and Give an Hour are just a few of the resources available to veterans. PTSD and suicide are among our veterans, and it keeps increasing. But prevention and treatment plans are increasing as well to help them. Raising awareness and educating our military members about resources can make a big impact on improving their mental health.